As a urologist and andrologist with 15 years of experience, I've noticed an interesting pattern in my office. Men over 60 often arrive accompanied by their partners, but rarely take the initiative to talk about their intimate concerns. It's only when we create a welcoming and trusting environment that the real issues begin to emerge. I particularly remember Mr. James, a retired university professor aged 65, who came to the office with his wife Sarah. Initially, he mentioned only a routine checkup, but his body language indicated there was more to be said. After a few minutes of discussing his general health, he finally found the courage to share his concerns about the changes in his intimate life. Mr. James's case is not unique. Studies show that more than 50% of men over 60 experience significant changes in their intimacy, but less than a third seek professional help. This silence not only makes it difficult to access effective treatments, but also perpetuates myths and prejudices about sexuality in later life. It's crucial to understand that changes in intimacy after 60 are natural and expected, just like other transformations our body experiences throughout life. However, this doesn't mean we should passively accept any discomfort or dissatisfaction. There are various resources, treatments, and adaptations that can contribute to a pleasurable and satisfying intimate life at this stage of life. As a healthcare professional, I have observed that many men interpret these changes as a sign of weakness or loss of masculinity. This misconception can lead to a cycle of anxiety and frustration that only aggravates the initial difficulties. It's essential to understand that seeking medical help is not a sign of fragility, but rather of self-care and responsibility for one's own health. Mr. James, for example, after a few consultations and adaptations in his lifestyle, discovered that his concerns were shared by many other men his age. By understanding that he wasn't alone and that there were solutions to his issues, his anxiety decreased significantly, which already contributed to an improvement in his intimate life. Intimacy after 60 can be a phase of rediscovery and new experiences. With the free time of retirement and the emotional maturity acquired over the years, many couples find in this period an opportunity to strengthen their emotional bonds and explore different forms of pleasure and connection. It's important to emphasize that intimacy goes far beyond the physical aspect. It involves affection, complicity, communication, and mutual understanding. Many couples discover that, with the natural changes of age, they can develop a deeper and more meaningful intimacy, based not only on physical attraction, but also on the emotional connection built over the years. As a society, we need to create a more welcoming environment for discussions about sexuality in later life. The first step is to recognize that the desire and need for intimacy don't disappear with age. They just transform and adapt to new life circumstances. In the following chapters, we will explore in detail the physiological changes that occur in the male body after 60, the different treatment options available, and practical strategies for maintaining an active and satisfying intimate life. We will also address the importance of emotional support and communication between partners in this phase of transformations. To better understand the transformations that occur in male intimacy after 60, it's fundamental to know the natural physiological changes that happen at this stage of life. As a specialist in men's health, I have observed that adequate knowledge about these processes significantly helps in accepting and adapting to this new phase. One of the main changes that occur is the gradual decrease in testosterone levels, the quintessential male hormone. This process, known as andropause, is completely natural and begins around age 40, with a reduction of approximately 1% per year. However, its effects usually become more evident after 60. Testosterone plays a fundamental role not only in libido and sexual performance, but also in body composition, bone density, red blood cell production, and overall well-being. Therefore, its alterations can affect various aspects of male health. Mr. Thomas, a 63-year-old businessman I've been following for a few years, described these changes very well. "Doctor, I noticed that my disposition is not the same anymore, both for daily activities and for intimate moments. At first, I was very worried, but after you explained about these hormonal changes, I started to understand my body better. In addition to hormonal changes, there are also changes in blood circulation. Over the years, blood vessels can lose some of their elasticity, which can affect blood flow to different parts of the body, including the genital organs. This is one of the reasons why some men may experience changes in erectile function. It's important to emphasize that these vascular changes can be minimized with healthy lifestyle habits. Regular physical exercise, a balanced diet, and control of risk factors such as hypertension, diabetes, and high cholesterol are fundamental to maintaining good blood circulation. Another important aspect is changes in tactile sensitivity. With aging, there can be a natural decrease in sensitivity in different areas of the body, which can affect the response to sexual stimuli. However, this change can also be seen as an opportunity to explore new forms of pleasure and intimacy. The muscle tissue of the pelvic floor also undergoes transformations with advancing age. These muscles are fundamental for sexual function and urinary control. Therefore, specific exercises to strengthen this musculature can bring significant benefits to intimate health. An often neglected aspect is the impact of changes in the nervous system. Aging can affect nerve conduction speed, which means that stimuli may take a little longer to be processed. This is not a problem in itself, but it requires an adaptation in how intimacy is experienced. It's crucial to understand that all these changes are natural processes and do not mean the end of intimate life. In fact, they can be the beginning of a new phase, with different ways of experiencing and expressing sexuality. The secret lies in understanding these changes and adapting to them in a positive and constructive way. In my clinical experience, I have observed that the men who best adapt to this phase are those who maintain an open mind and are willing to learn about their changing body. They understand that intimacy is not just about the physical aspect, but also encompasses emotional connection, affection, and complicity with the partner. In the next chapters, we will explore practical strategies and available treatments to deal with these changes effectively, as well as discuss the importance of emotional support and communication between partners in this phase of transformations. After understanding the natural changes that occur in the male body with advancing age, it's time to explore practical and effective strategies to maintain a healthy and satisfying intimate life after 60. As a specialist in men's health, I have observed that the combination of different approaches usually brings the best results. The first and most fundamental strategy is the adoption of a healthy lifestyle. Mr. Robert, a 67-year-old client, is an excellent example of how small changes can make a big difference. When he started experiencing difficulties in intimacy, we initiated a gradual program of changes in his lifestyle. At first, I thought it would be difficult to change habits of a lifetime, he shared. But when I started to feel the benefits, I realized it was well worth it. Regular physical activity is one of the fundamental pillars for intimate health. Moderate aerobic exercises, such as walking, swimming, or cycling, for at least 30 minutes 5 times a week, can significantly improve blood circulation and hormone levels. In addition, specific exercises for strengthening the pelvic floor, known as Kegel exercises, can bring significant benefits to sexual function. Diet also plays a crucial role. A diet rich in fruits, vegetables, legumes, whole grains, and lean proteins provides the necessary nutrients for hormonal and cardiovascular health. Foods rich in zinc, such as seafood and pumpkin seeds, and in antioxidants, such as berries and dark leafy vegetables, are particularly beneficial for intimate health. Stress control is another fundamental aspect that is often underestimated. Chronic stress can negatively affect hormone levels and sexual function. Relaxation techniques, such as meditation, yoga, or simply dedicating time to pleasurable activities, can significantly help in stress control. A strategy that has proven to be very effective is the practice of mindfulness exercises applied to intimacy. This technique helps to develop greater body awareness and focus on the present moment, reducing performance anxiety that many men experience at this stage of life. Mr. William, a 64-year-old architect, discovered the benefits of mindfulness in his intimate life. Before, I was very anxious, thinking about whether I would be able to perform satisfactorily. After I learned to focus on the sensations of the Moment without judgments, our intimacy improved significantly. Sleep quality also deserves special attention. During sleep, much of the body's hormone production occurs, including testosterone. Establishing a regular sleep routine, creating an environment conducive to rest, and avoiding the use of electronic devices before bedtime are important measures to ensure restorative sleep. Another fundamental aspect is care with medications that may interfere with sexual function. Some medications for high blood pressure, depression, or other conditions can affect libido or sexual performance. It's important to openly discuss with your doctor about possible side effects and available alternatives. A strategy that I have successfully recommended is adapting intimate practices to the body's natural rhythms. For example, many men discover that they have more disposition for intimacy in the morning, when testosterone levels are naturally higher. Adapting to these rhythms, rather than fighting against them, can bring very positive results. Adequate hydration is another often neglected but fundamental factor for intimate health. Drinking enough water helps maintain tissue elasticity and promotes good blood circulation. I recommend to my patients that they keep a water bottle always nearby and set daily hydration goals. Last but not least is care for overall health. Regular medical checkups, preventive exams, and proper control of chronic conditions such as diabetes, hypertension, and high cholesterol are fundamental to maintaining not only intimate health, but overall quality of life. In the next chapters, we will explore the fundamental role of communication between partners and the different medical treatment options available for those who need additional support on their journey to a satisfying intimate life. In my experience as a specialist in men's health, I have observed that even the best practical strategies and medical treatments can have limited effectiveness if there is not adequate communication between partners. Intimacy after 60 offers a unique opportunity to deepen emotional bonds and develop an even more meaningful connection. The case of Mr. John and Mrs. Mary illustrates perfectly the importance of communication. Married for 40 years, they came to my office facing difficulties in their intimate life. At first, only Mr. John spoke, while Mrs. Mary remained silent. By creating a welcoming environment for dialogue, we discovered that both had unexpressed concerns and desires that were affecting their intimacy. One of the first recommendations I make to couples is to establish dedicated moments for dialogue about intimacy. Not during intimate moments themselves, but in calm situations of daily life, where both can express themselves without pressure or expectations. This communication space allows fears, insecurities, and desires to be shared constructively. The language used in these conversations is also fundamental. I encourage couples to adopt positive communication, focusing not only on difficulties, but also on possibilities and what still works well in their intimate life. This approach helps reduce anxiety and create an environment more conducive to intimacy. The emotional bond built over the years is a precious resource that can be further strengthened at this stage of life. Mrs. Emily, a 62-year-old patient, shared an interesting observation. We discovered that our intimacy improved when we started dedicating more time to small gestures of affection throughout the day. A hug, a kiss, a sincere compliment. This was creating a stronger connection between us. It's important to understand that intimacy goes far beyond the sexual act itself. Affectionate touches, massages, caresses, and other forms of showing affection are fundamental to maintaining the emotional and physical connection between the couple. Many discover that these expressions of affection can be as or more satisfying than traditional forms of intimacy. The complicity developed over the years can be a great ally at this time. Couples who manage to maintain a sense of humor and a light attitude towards the natural changes of age generally adapt better to this new phase. Mr. Michael, a 68-year-old patient, summed it up well. We learned to laugh together at our limitations and discovered new ways to connect. An important aspect of communication is the clear expression of preferences and boundaries. With the natural changes of aging, what was once pleasurable may need adjustments, and new forms of pleasure may be discovered. The ability to openly communicate these changes is fundamental to maintaining a satisfying, intimate life. Respect for individual timing is also crucial. Each person has their own rhythm of adapting to changes, and it's important that the couple finds a balance that is comfortable for both. Pressure for performance or comparison with earlier phases of life can create unnecessary tensions. Emotional intimacy can be cultivated in various ways. Sharing memories, planning activities together, demonstrating gratitude and appreciation for the partner are ways to strengthen the emotional bond. Many couples discover that this deeper emotional connection significantly enriches their intimate life. Mutual support in other areas of life also contributes to a more satisfying intimacy. Couples who support each other in their personal projects, who maintain common interests, and who face the challenges of aging together generally manage to maintain a stronger connection and a more pleasurable, intimate life. In the next chapters, we will explore the different medical treatment options available and how to integrate all these strategies into a personalized plan for each couple. The key is to find a balance between the physical and emotional aspects of intimacy, always respecting the particularities of each relationship. As a specialist in men's health, I consider it fundamental to address the various medical treatments and interventions available to assist in intimate life after 60. It's important to emphasize that each case is unique, and treatment should always be personalized, considering the medical history, lifestyle, and individual preferences of each patient. Mr. David, a 66-year-old businessman, sums up well the importance of individualized treatment. When I finally gathered the courage to seek medical help, I was surprised by the variety of options available. The doctor explained each one to me, and together we found the one that best suited my case. One of the first steps in treatment is conducting a complete medical evaluation. This includes physical exams, hormonal analysis, cardiovascular assessment, and, when necessary, imaging tests. This comprehensive evaluation allows for identifying possible underlying causes that may be affecting intimate life and determining the best treatment options. Hormone replacement is one of the therapeutic options available, but it should be considered with caution and always under medical supervision. When well indicated and properly monitored, it can bring significant benefits not only to intimate life, but also to overall disposition, muscle mass, and bone density. There are different forms of administering hormone therapy, such as gels, transdermal patches, and injections. The choice of the best option depends on various factors, including patient preference, ease of use, and pre-existing medical conditions. Regular monitoring is fundamental to ensure the safety and effectiveness of the treatment. Specific oral medications for erectile function can also be a valid option. However, it's crucial that they are prescribed by a qualified professional, as there are contraindications and possible drug interactions that need to be carefully evaluated. Additionally, regular medical follow-up allows for adjusting doses and assessing response to treatment. Mr. Joseph, a retired teacher aged 63, shared his experience. At first, I was apprehensive about medications, but after a detailed conversation with the doctor about the benefits and risks, I felt more confident to start treatment. Regular follow-ups gave me even more peace of mind. Physical therapies can also be very useful. Pelvic physiotherapy, for example, can help strengthen the pelvic floor muscles and improve local circulation. Specific exercises, performed under professional guidance, can bring significant benefits to sexual function. In some cases, medical devices may be recommended as part of the treatment. There are different options available, from tension rings to more sophisticated devices. The choice should be made in conjunction with the doctor, considering individual needs and preferences. An important aspect of treatment is attention to associated medical conditions. Hypertension, diabetes, high cholesterol, and other chronic conditions can significantly affect intimate life. Proper control of these conditions, with medications and lifestyle changes, is fundamental to the success of the treatment. Integrative medicine can also offer complementary benefits. Acupuncture, for example, has shown promising results in some cases, especially when combined with conventional treatments. However, it's important that any complementary therapy is discussed with the doctor responsible for the treatment. Psychological counseling can be a valuable component of treatment, especially when emotional or relational issues are involved. The integration between medical treatment and psychological support often brings more satisfactory results. The response. Time to treatment can vary significantly among patients. Some may notice improvements quickly, while others may need more time or adjustments in treatment. Patience and persistence are fundamental in this process. It's important to emphasize that the goal of treatment is not only to improve physical aspects but to promote a more satisfying, intimate life as a whole. This includes considering emotional, relational, and overall quality of life aspects. In the next and final chapter, we will explore how to integrate all this information and strategies into a personalized plan for a full and satisfying, intimate life after 60, as well as discuss future perspectives and new advances in the field of male sexual health. Throughout this journey of discoveries about intimacy after 60, we explored several fundamental aspects, from natural physiological changes to practical strategies, from the importance of communication to available treatment options. Now, it's time to integrate all this knowledge into a positive and constructive perspective for the future. As a specialist doctor who has been following men in this phase of life for years, I have the privilege of witnessing true stories of transformation. Mr. Richard, a 69-year-old patient, sums up this perspective well. When I noticed the first changes in my intimacy, I thought it was the end. Today, after understanding my body better and implementing the necessary changes, I discovered that it was just the beginning of a new phase, equally gratifying. The key to a satisfying, intimate life after 60 lies in the harmonious integration of different aspects. It's not just about addressing physical or emotional issues in isolation, but about building a personalized plan that considers the individual as a whole. This includes physical, emotional, relational, and even spiritual aspects. The development of sexual medicine has brought significant advances in understanding and treating issues related to intimacy in later life. New research and technologies are constantly emerging, offering increasingly promising perspectives for those facing challenges in this area. A fundamental aspect that I have observed is the gradual change in how society views sexuality after 60. Increasingly, it is recognized that the need for intimacy and connection is a natural and important part of life at any age. This change in perspective has helped many men feel more comfortable seeking help and openly discussing their concerns. Mrs. Susan, wife of a 71-year-old patient, shared an interesting observation. We realized that when we stopped comparing ourselves to the past and started appreciating the present, our intimacy gained a new dimension. Today, we value each moment of connection in a different and deeper way. It's fundamental to develop a realistic but positive view of intimacy at this stage of life. Changes are inevitable, but they don't mean the end of intimate life. On the contrary, they can be the beginning of a new way of experiencing and expressing sexuality, more mature and conscious. Self-knowledge plays a crucial role in this process. Understanding one's own needs, limits, and desires allows for making more conscious and appropriate choices regarding necessary treatments and adaptations. This knowledge also facilitates communication with the partner and healthcare professionals. Overall quality of life is intrinsically linked to intimate health. Therefore, it's important to maintain a holistic view, caring not only for aspects directly related to sexuality, but also for mental, physical, and emotional health as a whole. Social support is also fundamental in this journey. Support groups, couple therapy, and exchanging experiences with others who are experiencing similar situations can be very enriching. Many of my patients report that the simple fact of knowing they are not alone in their experiences already brings great relief. The future of sexual medicine is promising, with new treatments and approaches being continuously developed. However, it's important to remember that technology and medical treatments are only part of the solution. The real key to a satisfying, intimate life lies in the harmonious integration between body, mind, and relationship. For those who are starting this journey of rediscovery, I leave a message of hope and encouragement. Intimacy after 60 can be a phase of great achievements and satisfactions. With adequate knowledge, professional support when necessary, and a positive attitude, it's possible to build and maintain a fulfilling and gratifying intimate life. As a healthcare professional, my role is to be an ally in this journey, offering not only technical knowledge, but also understanding and support. Every day, I learn more from my patients about the importance of approaching this topic with sensitivity, respect, and optimism.